And live on Facebook. All right, that all looks like it's working. Okay, great. I think that's up and running. Wait 1 second. Go live. Okay. Okay, I think we're on everywhere. Sorry, I had a little trouble with this Facebook thing.
Hello world, if people are hearing us, we're just about to hit start on the broadcast. Thanks for joining.
All right, I think we are on. Welcome, everybody. Welcome to everyone who's out there. Thanks so much for joining us on Saturday. Here in New York, it is a beautiful Saturday. If we want to cultivate resistance, all you have to do is go outside and take some sun and get some beautiful chi or prana that's out there for us. So I want to thank everyone for being here and spending your valuable time. Everyone's time is amazingly valuable, and we want this to be really worth your time. So we're going to dive right into it. All right. Okay, so I'm going to introduce myself. I'm Peter Bongiorno. I'm a naturopathic doctor and acupuncturist. I co-direct InnerSource Health, and I'm a board member and past president of the New York Association of Naturopathic Physicians. With us is Dr. Rishi Sood, who's a medical doctor, and he's associate medical director of the Amen Clinic here in New York, and he's board certified in adult psychiatry and child and adolescent psychiatry. And the first time I met Dr. Sood was actually probably a couple of years ago when we first got to know each other, and we met in a small restaurant, and he came in soaking wet because he was sweating profusely from the yoga class he had just gone to. And I thought to myself, here's a guy who's really living what he's talking to patients about. And I just think that's a beautiful thing, because when you see a doc and you see a practitioner who's not only telling people good things to do, but are doing it themselves, it just becomes so much more inspiring. So thank you for inspiring us. And also with us is Dr. Robert Kachko, also like myself, a naturopathic doctor and acupuncturist. He is also the president of the American Association of Naturopathic Physicians. So he's the president of our national organization. And he is the leader of moving us forward in terms of getting licensing here in the United States, in all states right now. Naturopathic doctors are licensed in 26 states. So thank you, Rob, for doing everything you do. He's also an amazing colleague, and he's brought so much to InnerSource Health. Day after day, he's making it better and improving things, and I thank you for that. And it's just always been such a pleasure to work with you. And he's also the founder of Tribe RX. And if you want to go to his website, drrobertkachko.com, you can learn more about that there.
Thank you, Peter.
Oh, my pleasure. So just as a disclaimer, this webinar, and actually there's an article I wrote about virus that's on our website. It's meant to enhance conventional medical recommendations, not replacement. And the information in this webinar is educational. It's not to decide to replace medical advice. Always speak to your licensed medical practitioner for your healthcare. So when we talk about resilience, first we have to talk about stress. The definition of stress from Hans Selye in the 1930s is the process by which the body responds to changes in the environment. So stress is actually how we respond to what's going on around us. And distress is actually when stress goes past our ability to cope. So people can go through different stressors, and some people can have minor stressors and go into distress, and some people can have major stressors and still be very, very calm, very centered. And this is what we want to talk about today. What is it about our bodies and our brain that allows us to either deal with the stressor and changes and fear going on in our life, or what allows us to kind of not be able to meet that challenge? Resilience is the process by which the body responds to a change in the environment. So when you have resilience, you can adapt. You can make changes in your body, in your thought pattern that allow you to stay calm, that allow you to stay centered, that allow you to stay balanced. And in this time of COVID-19 and everything going on, it's very important that we have resilience. I remember in 2008, I was in practice for about 4.5 years, and we had the economic downturn. And at that time, male suicide rates and depression went way up. Suicide rates in men probably went up about 7%, and depression was robustly enhanced as well. And what we learned then is that when the economy goes down, when men are worried about how they're going to provide for their family, how they're going to support themselves, they can become very stressed to the point where their resilience goes down and breaks, and then they can't cope anymore. And of course, suicide is the ultimate feeling that you can't cope to the point where you don't want to be around anymore. But there are many steps that lead to that. So we want to talk about today resilience and what are the ways we can support our body so that we don't get to that place where we feel like we can't cope. And of course, anxiety is a part of that, right? When we have anxiety, it's really a symptom that the body's getting overwhelmed. Hans Selye in the 1930s, he talked about how the body generally is in homeostasis and is balanced, and this is where we feel centered. But sometimes when there's a stressor a long time, our body alarm stage goes up. Things change in our body, which I'll talk about in a minute. We have what's called the resistance stage, where our body changes get to the point where the body can't really handle all the changes anymore. And then we start to break down and we get into what's called the later resistance and the early exhaustion stage. And that's when really the body has no more resources to deal with the stressors that happen. Right. And so this is a graphic from my book, and it's just another way of saying the same thing, that when there's a lot of stress going on in the body, maybe when there's a lot of inflammation going on, it affects a part of the brain, a middle part of the brain called the hypothalamus, which puts out a bunch of stress hormones, which goes to the pituitary, which puts out more stress hormones, which goes to our little adrenal glands on the top of the kidneys, which puts out things like cortisol, which is another stress hormone. And when that happens in the short term, what happens is we run, we can fight, we get away from the stress, and things can get better, right, as the stress goes away. But when the stress is long term, or we feel like it's long term, maybe because our thoughts are constantly increasing those stressful feelings in our body, then we could start to have things like fatigue. We could start to have sleep problems. We could start to not enjoy the things we used to enjoy. Our appetite can change. Sometimes it goes up, sometimes it goes down. Our bodies get chronically inflamed, and we'll see things like anxiety, depression, panic disorder, obsessive compulsive, things like that. Bruce McEwen was a researcher at the Rockefeller University, and he actually studied what was going on with stress in the body, and he came up with this term allostatic load or allostatic overload. And he actually looked at the body and different markers in the body to see whether a person was getting to the point where their stressors were becoming overwhelming. And he would look at things like cortisol, which this GR here represents for stands for glucocorticoid resistance, meaning when cortisol goes way up, the body actually stops listening to it. And so the body makes more and more cortisol to try to compensate for that. And cortisol itself can bathe the brain. It kind of beats up the brain. It makes us feel very depersonalized. We get a lot of stress feelings that occur with cortisol. At the same time, DHEA can go down. DHEA is another adrenal hormone that's very important for a number of processes, including balancing inflammation and also protecting the brain from the stress hormones. Another stress hormone epinephrine can go up. Like I said, inflammation goes up. Good cholesterol can go down. Blood pressure goes up. Blood sugar goes up. Insulin goes up. And even the waist to hip ratio, right? We end up kind of getting into the stress mode, and we pack more fat, most of us, in areas where we don't want it. And so overall, that just suggests that our bodies are becoming less and less healthy as we're becoming less and less able to respond to stressors. And if any of you have been in our practice, you know that we like to look at your stress hormones, and we run these urine adrenal tests. And that's why we're looking at them, because we're looking at changes in cortisol. Is a person's cortisol going way up too high, and showing us that their resilience is actually, you know, going down in the process. Sometimes people's cortisol goes down and goes up at night, and we see a lot of sleeping problems and things like that. So testing like that can be very helpful, as well as blood tests that look at some of the other parameters I talked about earlier. So, and the thing about glucocorticoid resistance, like I said, when that cortisol is very high and the body stops listening to it, we also see changes in the thyroid. We see changes in the gastrointestinal tract, and our digestion doesn't work well, which of course is going to increase inflammation and create an imbalance in the neurotransmitters. And we're going to even see changes in female hormones and what goes on with reproduction, which is one of the reasons why you see fertility decrease when there's a lot of stress chronically in the body. So these are all just signs of low resilience, of different systems in our body not reacting well in the long term, because it just can't handle that level of stress hormone that's going on continually. So Shakespeare said, "Wise men ne'er sit and wail their loss, but cheerily seek how to redress their harms." So what he's trying to say is that when people are smart, they figure out how to not dwell in the loss, but actually be able to move forward and fix the things they need to fix. But the problem is, and maybe Shakespeare didn't think about this, is when your body, when the cortisol is very high and the norepinephrine is very high and all those inflammatory changes are happening and neurotransmitters drop, sometimes it's hard to create that grit, you know? So, and that's what we want to talk about today. Like, what can we look at more to help those things rebalance so that it doesn't keep getting more and more out of balance? And from a very general standpoint, the things we want to think about is learning about your body, you know, maybe doing the testing that can help us understand. And Dr. Sood in a little bit is going to talk about some very special testing he does at his clinic to help learn more about the brain and and the body. And of course, from a naturopathic perspective, making sure you're sleeping enough, making sure you're exercising, meditating, doing relaxation work, following your passions and doing the things you love to do in life. That's critical. Spending time in nature, spending time with people you love, whether it's in person or virtually, you know, but having a community of people who support you, making sure you're getting the right healthy foods in your body, detoxifying, because sometimes too many toxins in our environment can be part of the reason why our resilience can go down. And then getting the right nutritional supplements and things to really support, like, for example, with the adrenal glands, we use these things called adaptogens, which are very good for balancing the adrenals and supporting them so that they don't burn out so fast. So with that, I'm going to stop my screen and let Dr. Sood take over.
Thank you, Peter. I'm going to share my screen.
And while, you know, please feel free to start typing questions in. What we're going to do is at the end, we're going to leave about 15 minutes for questions. So please do go into the chat, go into the Q&A, start leaving questions, and then all three of us will be available to answer questions at the end.
So Peter, thank you so much. It's really a privilege to join everyone here during this difficult time. Peter and Rob have been amazing colleagues. I really admire how they really work with the individual at the core. And when I send clients over, the feedback I get is, you know, wow, you know, we've really gotten better and feeling better, and a lot of gratitude, and just the generosity, the care, the commitment is wonderful. So it's an honor to join you guys. So I work at the Amen clinics, so what we do at the Amen clinics is we look at the brain. So our hypothesis is that if your brain is working well, then your going to be working well. And so we take a brain systems approach, and we combine that with an integrative approach, working with Peter, Rob, integrative practitioners to help our clients optimize brain health. And this is essential during these troubling times, these difficult times. So it's wonderful to be able to join and talk about resilience, and I'll specifically talk about brain health and how what we can do. So we've been looking at brain since 1991. Dr. Daniel Amen, he's our founder. He sort of came up with thinking that when the brain is working well, we work well. Our lives are better, our relationships are better, we think better, we feel better. So conventionally, when you go to you have a cough, it's difficult, you have difficulty breathing, you'll go to the hospital, and these days you'll get a chest x-ray, and that chest x-ray can tell you a lot. It can tell you whether you have a pneumonia, you have an infection, and that can lead to more accurate, more reliable diagnosis and then successful treatment. And the same approach should be utilized when we're talking about depression, anxiety. We're trying to cultivate resilience. The brain is essential in allowing resilience to occur. And same thing, you go to the cardiologist or the emergency room with crushing chest pain, you're going to get an EKG, and that's going to tell us you a lot. You're not just going to be given a medication and told to go home. So, our thinking is that, you're experiencing severe anxiety, panic, grief. That's not going away, despite some, interventions such as the exercise, such as the breathing, such as, some supplementation and maybe medication. Then why not look at the brain? So we use SPECT imaging to look at the brain. So SPECT imaging is a functional imaging tool. So in contrast to an MRI or CT scan, which looks at the structure of the brain, SPECT looks at blood flow. So these pictures are looking at the cortex, the surface of the brain, and what we're seeing is a healthy brain. So the color here is not important. What matters is how smooth the surface is. So we'll talk about a couple areas during this talk, and we'll talk about the prefrontal cortex, we'll talk about the limbic system and the basal ganglia specifically, and how optimizing those areas can help us feel better and cope with stress more effectively. So I talked about earlier about how traditionally, when you're going for a mental health evaluation, generally we ask you about symptoms, we take a clinical evaluation. So we do that, and we also at the Amen clinics use this imaging tool. And then when we get the information from this imaging tool, that then tells us, hey, we need to send our clients to InnerSource Health, Peter and Rob, to get a better idea of what's really driving this physiology that's leading to this individual's feeling. So we're not against sort of the conventional approach. We believe very much in taking a history, asking about symptoms, but we want to know where those symptoms are coming from, and then refer to individuals who are going to, I think this concept in medicine is very important. First, do no harm, right? When someone comes to me for depression, I don't think, my immediate thought is not Prozac or Zoloft, or my thought is like, what is driving this? What can the individual do? Is the individual capable of doing in terms of addressing this issue? And who can I really trust reliably to really help that individual through a difficult period? So we take a biological, psychological, social, and spiritual approach. So the biological piece would be, for instance, what's your sleep look like? How many hours of sleep are you getting? What is your nutrition looking like? How much sugar are you taking in? What are the types of fats you're eating? Protein, so protein increases dopamine. Dopamine can help us with focus. whereas complex carbs increase serotonin, and that can help us feel relaxed. So this can definitely impact brain functioning. So nutrition, sleep, exercise, very important to help us, help our brains and help our brains during difficult times. What's our psychology? What's the constitution of our psychology? So what thoughts do we believe? Our thoughts can help us and our thoughts can hurt us. Who do we socialize with? Do we socialize? And what's our purpose? So it's very important to look at the brain and also understand the brain in terms of the impact of the biological, psychological, and social, spiritual factors and how they interplay. So we looked at a scan or a set of scans earlier that was looking at the surface, and you'll see that on the left. On the right, we're looking at deeper structures. So on the left, I kind of like to look at this picture as your thinking brain, namely the prefrontal cortex, which we'll talk about. And on the right, we look at kind of more of the emotional brain. We'll talk about some structures as it relates to that. So what does the prefrontal cortex do? So the prefrontal cortex is, this is what sort of separates us from animals. This is the part of the brain that sort of is able to, it's the CEO of our brain. It's able to sort of decipher extraneous noise, focus on a signal. It helps us with our executive function, organizing and planning. So when our frontal lobes, our prefrontal cortex are working well, we work well. We're able to focus more efficiently. We're able to think before we maybe act or speak. We're able to learn from our mistakes. So during these difficult times, we're going to make mistakes, right? We may not be the best partner, right? If our prefrontal cortex is working well, then we can say, okay, I wasn't the best partner. Let me learn from this. If our prefrontal cortex isn't working well, we may continue to not be the best partner. So understanding our brain and understanding deficiencies or how it's working well can really help us, continue to cultivate resilience. So the next structure we'll talk about is the deep limbic system. So the deep limbic system, so if you look at the image on the right, and if you look at the central part of that, there is a white area, sort of circular white area. That's the deep limbic system. So the deep limbic system functions to integrate sensory information. So all of our senses come through this area, and this sets the emotional tone. And when our limbic system is very active, what happens is that this begins to dominate our life. So our emotional sort of, we're taking over emotionally, and our frontal lobes stop working. And when the limbic system is very active, we can struggle with depression. So sleep issues, low interest, things we're not interested as much in, things we once were interested in, feeling guilty, having low energy, appetite issues fluctuate, appetite fluctuates, feel tense, agitated, and hopeless at times. So why is this important? So why is looking at the brain important? So two individuals with depression can look very differently, not only in person look very differently, but also their brains can look very different. So on the left, we see an individual who's coming in to see us who has depression. And in their case, their limbic system is active. So that treatment, the way we target that brain is going to be very different from the way we target the brain on the right. Brain on the left, we're going to work to enhance serotonin, norepinephrine, and also dopamine to target another area in the brain, the cerebellum. And on the right, we're going to primarily come at the brain with supplements, treatments that would increase serotonin, GABA. So without going into too much detail here, the major point is that we can present with similar symptoms, but our brains, depression can present in same way clinically, but the brain may look different. So this sort of informs us. The last structure I will talk about is the basal ganglia. So the basal ganglia is what sets the body's idle. When the basal ganglia are active, we tend to worry, predict the worst. So we want to calm that down. So ways in which we can calm basal ganglia activity down are deep breathing, meditation, yoga. So I'm not going to go into treatment so much. My main sort of what I'm hoping to sort of communicate is that looking at the brain is important. Taking care of the brain is important. Not just a one-size-fits-all approach is we need to think a little bit more broadly. And so what can we do? Let's talk about how am I doing on time, by the way?
Got a couple more minutes.
Couple minutes?
5 minutes.
5 minutes. Okay.
Okay.
Great. Yeah. So so risk factors. What are areas of focus, and how can we look at these areas to help us during this stressful time? Let's talk about this time. Let's talk about resilience, and let's talk about how we can cultivate resilience during the time of COVID. So we'll talk about this mnemonic, bright minds. So blood flow. So blood flow is very important to the brain. So one way in which you can increase blood flow to feel better is exercise. Exercise is very important. So what I recommend is, 15 to 20 minutes a day, make this a priority. Maybe first thing in the morning, earlier in the day, so you get it done. If you do this, you're going to increase neurotrophic factors, growth factors that are going to help brain function. You're going to feel better. So highly recommend integrating some sort of exercise during these times. So during this time, it can be we may be retiring our brains, meaning we're not interacting with others. We're not going to work. We're not engaging in new learning. So some sort of new learning can really help us. We want to cultivate that. Inflammation. So the food we eat is very important. So trying to stay away from processed foods, trying to eliminate simple sugars can be very difficult, but what you put in your body impacts how your brain functions and how you feel. Your genetics. So there's this thinking that we're determined by our genes. Some people think that we're given these genes, and if our genes aren't working well for us, we're doomed. This is not the case. We can turn off and turn on our genes through one process called methylation, which can make, so the things we do actually can change our genetics. So we have more power than we realize. Head trauma. So we want to protect our brain. Hitting our brain is not going to help us. Toxins. So toxins can be from our environment, from the air we breathe, right? From mold, from Lyme's disease, so when we're thinking about resilience, stress, depression, anxiety, we want to think about toxicity. Mental health, very important to treat and address and to destigmatize mental health. Depression, anxiety not only affects the individual at their core in the moment, but can affect the individual down the road. Untreated depression, anxiety increases the risk for Alzheimer's disease. Immune health, very important. Looking at vitamin D levels, looking at inflammatory markers. Peter talked about hormones. So assessing for hormonal imbalance, blood sugar, and then sleep. So we'll look at sleep quality, we want to assess for sleep apnea. So what are a few things that we can do, some simple things that we can do during this time to cultivate resilience? Exercise, managing stress, so our automatic negative thoughts. So we want to be able to identify our thoughts, challenge our thinking, right? What is the thought? Is the thought true? How do I feel when I believe the thought? How do I feel when I don't believe the thought? So let's take, for instance, we're never going to find a cure for COVID. We're going to be living in this forever, and we're doomed. So is that necessarily true? Is that thought true? Well, yes, it's a stressful period of time. Are we never going to find a cure? Are we doomed? Well, we don't have evidence. We are making progress. How do we feel when we believe that we're doomed and we're not going to, find a cure? Feel really scared. You feel stressed, right? But when we challenge that thinking, when we say, maybe I'm wrong, maybe we are moving in the right direction, feel a little bit better. So when we change our thinking, our brains change. The way we secrete, release, produce neurotransmitters, that ability to improve that improves. So our thinking is very important. Meditation, diaphragmatic breathing, learning new things, and can really help. So, and then nutrition, targeted supplementation can also help with supporting the immune system. And yeah, when your brain works better, we work better. And so working at the AIM clinics, there's some information there. Do you have any questions? Maybe just write something on a chat and I can respond that way. But yeah, I'll turn this over to Rob. Thanks for having me.
Thank you so much, Rishi. So let me just pull my slides up. All right, we'll try to go through this as quickly and efficiently as possible. I have to say that we've been working with Dr. Sood and the aiming clinics for a long time now, and truly medicine is heading in this direction of precision medicine, of really understanding how to personalize care for each individual patient. And Dr. Sood and his team have been champions of that in New York City and the aiming clinics in multiple locations. Have really been champions of that, of this idea that the brain is dynamic. That he mentioned this idea that MRIs and CAT scans look at structure, but there's a lot to be said about looking at function of the brain. And core to resilience is the ability to adapt, the ability to self-regulate effectively. And that's something that they're looking at in real time, which is really important. Bringing this to the moment that we face right now, when the three of us got together and decided to talk about resilience as a concept, we were thinking about what can we add that's really novel to the conversation right now. There's a lot out there around, coronavirus, antivirals and nutrients and hydroxychloroquine or whatever medications might be out there. We wanted to add something hopefully novel. And from my perspective, when we think about resilience, when we think about that dynamic, adaptive, self-regulating ability, we have to consider it from two perspectives. One is from the perspective of mental emotional resilience, and then the other is from the perspective of immune resilience. And in supporting the physiology, we have the capacity to do so. So my slides are going to talk about these two areas separately. First, we're going to start and we're going to talk about how mindset and the ability to understand the context of what's going on in our lives plays a role in our ability to be emotionally adaptive and resilient. And then we're going to transition into talking about how we can support the physiology with some nutrients and botanicals that are really specific to what people are worried about right now. I always want to bring this down to the level of practicality. And so hopefully we'll do so. I think we have a lot of healthcare providers on this call, which is great. So I'm going to try to bridge the line of sharing some of the research, but also giving actionable tips. We can share all these slides afterwards. So if you're interested, just send us an email at info@innersourcehealth.com. I'd be happy to share the slides, and I'm sure Dr. Sood would be happy to do the same. So when we talk about the moment that we're in right now, just to put it into context, there's a tremendous amount of uncertainty. There's a tremendous amount of fear. Is my family going to be healthy and safe? Is my job going to exist in a couple of months if I still have a job? Unfortunately, fear, if we look at all the social science research, is a really good motivator of inaction. Fear gets us to stop doing things, assess the scene, and then pause before we can move forward. That's kind of what we've done especially in New York City, New York State, right? We even called it New York on pause. The challenge is a lot of what we talk about here from the perspective of changing resilience and functional and dynamic brain approaches really requires taking action, being proactive, and feeling like we're protecting ourselves. That actually lights up a lot of those brain regions in the right way. High feelings of self-directedness and self-efficacy actually influence that prefrontal cortex. It influences the anterior cingulate cortex, which is a part of that emotional system. So there's a lot that we can do. And the way to access that is through hope. Now, it's really easy for me to sit here and say, well, get rid of your fear, just feel hopeful. The bridge between where we are and this feeling of uncertainty and this feeling of need for hope really is understanding, is grounded understanding about what's happening in the world around us. And the truth is that what's happening in the world around us is we're hearing a lot from multiple sources, not always very credible, and hearing it all day for weeks at a time while stuck at home without the capacity for social connection, which really buffers us against these things, can cause a lot of overwhelm. And so I saw on the attendees list, I've got a lot of my patients on, and one thing that I've talked to most of them about is really limiting that news cycle, controlling what we can. And so before we talk about how we can be resilient, how we can build resilience to the storm around us, we also have to maybe control the storm a little bit. And so I'm asking people in a very practical way, 3 news sources, no more than 30 minutes, twice a day across the board. I find in the first 2 weeks, I was watching and listening to every news source, and family and friends were sending me, did you read this article? Did you see this video? Overwhelm, right? And I found that unless I can control that news cycle, that was going to be very difficult. And that's important for a very specific reason. So Dr. Sood talked about different parts of the brain and how they react to the world and how we can in real time assess them. But the brain often takes signals from our body. And specifically, the bridge between brain and body is what we call the autonomic nervous system. That's the part of our nervous system that you may have heard about that talks about the fight or flight response. That's the part of our nervous system that causes us to freeze if we've got something that's a threat around us. That's that fear mechanism that we talked about. Well, that part of our nervous system, its primary job is to keep us safe. The reason I've got this ominous looking tiger on this screen is that in a very real way, based on our evolutionary biology, our bodies can't quite tell the difference between the threat of coronavirus or a boss or a spouse yelling at us or a tiger 25,000 years ago coming through the bush. And that's because we've cultivated it in an effort to protect ourselves, in an effort to make sure that the things that are most scary in the world don't actually end up getting us. We've cultivated something called a false positive bias. So very briefly, a false positive bias basically means that it's much more costly to assume that there's no tiger coming out of the bush that's going to get us and be wrong about that than it is to think that there's always a tiger coming out of the bush to get us and be wrong about that. And so we're always on guard when we live in a stressful state. Peter talked about Hans Selye's model. If we live in that state for too long, that's when we get into the exhaustion state. That's where our hormonal system, our autonomic nervous system simply can't keep up. The way out of that is to listen to our bodies, is to understand, first of all, that there is a lot out there that can threaten us, but that our bodies are generally safe. And the way to access that autonomic nervous system is to feel into our bodies. Because though they don't know from a conscious perspective what's happening in the world, our bodies feel all of this. And the key to unlock that perspective of listening to our bodies and allowing ourselves to be in the present moment is to be in the present moment. There's this concept of the here and now. You've heard about it through meditative traditions. We're going to talk about one tool in a moment that can help you access the here and now, but it's an important tool because, so Dr. Sood talked about, again, the prefrontal cortex and the limbic system. Well, there's a part of our brain, it's really a network of areas called the default mode network. And the default mode network really is responsible in sort of the narrative arc of our lives and our self-referential processing. And that default mode always lives at some point in the future or at some point in the past. And put another way, that default mode is sort of growing attached to some idea of the future or resistant or regretting something for the past if we take the negative perspective on it. The only way to get out of that default mode is to come into the here and now. So again, meditative traditions, we see that meditation turns down the default mode. We're going to talk about gratitude in a second, that turns down the default mode. These parts of the brain are really responsible, not just in our sort of mind wandering and sort of building the narrative arc of our lives, but they're also responsible for our happiness, our likelihood to feel anxious, and our resilience. There was an interesting study that came out years ago. In fact, you'll know how long it was because they gave people pagers and they asked them two things. They asked them, what are you doing in this moment? And how do you feel? And pretty consistently across the board, what was found is that people whose minds were wandering and focusing on something else other than the thing that they were working on, their task at hand, were much more likely to be unhappy, were much more likely to be anxious. And so the same lessons can be applied to what we're dealing with today. As much as we can stay present in the moment and focus on our task at hand, the less likely these fear states will turn into overwhelm. And so truly, if we can educate ourselves, that's important. There's a couple of other things that we've learned through the social science research. First of all, we are social creatures. Peter talked about what happened in 2008 with suicidality. What we know is that people who are most isolated, most lonely, have a 10 times higher rate of suicidal thoughts and also 10 times higher likelihood of actually acting on those thoughts. What's unique about this moment right now, unlike anything we've ever experienced as a species before, is though we have the preconditions for stress and trauma and all that, we're all experiencing it together. We're all experiencing it at the same time. And with the advent of technology, we're seeing it in real time, how we're all in the same boat. So this feeling like we're not alone really, I hope, can be a buffer for us in being able to relate to others and being able to calm some of these brain areas down. The other thing in the social science research that we find is that in addition to connecting with people, in addition to seeing that, other people are in the same boat, it's also useful to be of service. And so I'm asking my patients, find one way that you can be helpful to someone else, because in a very real way, that actually helps us to feel more resilient and to be less reactive to whatever's going on around. And then finally, we started with this concept of controlling what we can. Super important right now. Control what you can, set up a routine. Our bodies are creatures of habit in a very real way. And so as much as possible, try to have the same sleep schedule, try to eat at the same times, try to exercise like Dr. Sood said at the same times. Those checkpoints throughout the day become moments for our body to create expectation and to come back into that here and now. Without that regularity, that becomes much more difficult to do. And I'm seeing that especially people who are working from home or who have not been working, that's been a real challenge. So being proactive on that is really important. And I wanted to give a really useful, but also very easy and accessible exercise. I hear often that, meditation is difficult for me. I've tried, I'm not a meditator. I can't do it. Fine. Even though we see in the research that just the very act of trying actually has a lot of the same benefits, even if you don't feel like you're levitating, over a pillow and having this otherworldly experience, I find gratitude practice is much more accessible for people. And I want to break it down into 3 very easy steps. And I'd ask people to practice this for 2, 3, 4, 5 minutes a day. I know I do, and I know it helps me. The first step is just settling into our bodies, gently closing your eyes, taking a few gentle breaths, just noticing that breath. You don't have to expect a meditative experience, just notice 2 or 3 breaths. The second is to feel a feeling of gratitude. Now, the word feel is really important there. It's not just about thinking about a person, a place, an idea that we're grateful for. It's actually feeling that feeling. Often it's helpful to focus on the center of your chest and kind of feeling what that gratitude feels like. Often it's a warmth or a different type of vibration in the center of your chest. And when you've been able to feel that, the third step is to radiate it out. Radiate it out to the rest of your body, but also in the tradition of loving kindness meditation, radiate it out to other people in your life, other people in the world who need the support, other people who you feel grateful for. Those 3 steps have been scientifically proven to bring you back into that here and now, to bring you into that hope part of our screen as opposed to that fear part of our screen, and also to turn down that default mode network that we talked about. So I do encourage you to try to have some kind of practice like that. I just find that gratitude practice is often the easiest one. So we talked in the beginning, there's 2 components of resilience that we want to talk about. One is mental emotional resilience. The other is immune resilience and supporting our bodies. What we know is the immune system, much like the brain, is malleable. It can change, it can adapt, and if given the right tools, of course, given our individual susceptibilities, it has the potential to react well to whatever it's exposed to. We've probably done at this point, Peter, 10 or 12 different webinars on the immune system and how to build immune resilience and all that. So I'm not going to talk about all the nutrients and botanicals on this slide. They're all independently useful and clinically useful, and many of them have research around viruses specific to coronavirus. We don't have much on novel viruses at this time, but we do know a lot about how to build immune resilience. What I want to talk about in our remaining time, which actually, Peter, how much time would you say I have? Maybe 10 minutes?
5 minutes.
Okay, I'll do my best. And like I said, I promise to send these slides because you'll see there's a lot on them. So I'll just give a high level. But what I thought might be useful, instead of just telling you, again, to take vitamin C and what immune herbs are helpful, is to talk about the different tools in our toolkit that we have that really sit at the intersection between emotional resilience and immune resilience. And so we're going to talk very briefly about 4 botanicals and 3 nutrients that have a real role to play and hopefully will be novel and something that we need to study as we move forward. Because what's true is, there was a really great article called The Hammer and the Dance that came out in early March or in the middle of March that talked about, well, we had this initial phase, this hammer, everything shut down. We had social distancing and public health measures were put into place. But now we're really entering the dance phase where we're going to go in and out and really try to navigate things. These tools to support the immune system, but also to support our long-term emotional resilience, to avoid that exhaustion stage that Peter talked about earlier, provide a novel opportunity. And so the first on this list is turmeric. We've got tremendous research that talks about the role of turmeric for both depression and anxiety, even compared to pharmaceuticals like Lexapro. Now, it's important that I give the caveat that you shouldn't be taking any of these recommendations without a physician on board who helps you navigate what's appropriate for your situation. None of this is medical advice, but we do know that turmeric can be helpful in helping people build mental emotional resilience. And similarly, one of the concerns that we've had with coronavirus is the thing that actually kind of puts people into the dangerous stages in the ICU is what's called the cytokine storm. Inflammation that's gone overboard to try to protect our bodies from the virus that actually ends up unfortunately hurting us. Cytokine storm isn't a new concept. It's been studied for a long time. Here's a study that talked about the role of the cytokine storm in Ebola, which is a very severe viral infection. And it seems that there's some early research that shows that turmeric might be useful in addressing the cytokine storm. So again, so long as you talk to your healthcare provider and it's safe for you, might incorporating turmeric into your regimen to turn down inflammation at a lower dose than what we'd be giving someone in the acute stages of cytokine storm might that be useful for you. Similarly, skullcap. Skullcap is a wonderful herb that we've used for a long time. It's a nervine. It's really helpful for nervous exhaustion. Listed on the screen, I have 2 different species of Scutellaria skullcap. One is that Lateriflora, and this species seems to work similar to benzodiazepines, not as strongly of a binder to the GABA receptor that benzodiazepines bind to, but it seems to be helpful. And I find, and I know Peter does as well, that clinically it's a really nice calming herb. What's also really interesting about this genus of botanicals is that they're pretty potent anti-inflammatories. And we're seeing a lot of really early research coming out of the traditional Chinese medicine community that talks about a lot of the botanicals in traditional Chinese medicine and how they might be useful and how they were actually being used in the hospital systems to help people address the acute stages of COVID, even in the acute stages. And all of that is probably likely because of the anti-inflammatory effects of Scutellaria. In particular, it's the Scutellaria bicolensis. Bicolin is a novel molecule that seems to help in a lot of ways. It's anti-inflammatory, but it also, it basically, without getting into detailed, it alkalizes the endosome, so it prevents the virus from entering the cell in a pretty effective way. We've got a couple of other botanicals that do that in similar ways and related. You may have heard of the idea of hydroxychloroquine being useful. Hydroxychloroquine is what's called a zinc ionophore. So quercetin and green tea actually do similar things. So this viral entry, bicolin, is potentially very useful. And it's been studied in sort of the first cousin of coronavirus. In 2003, there was a lot of research that was out there to look at, well, what might be useful if the first SARS-CoV-1 comes back, and it looked like compared to a bunch of antivirals, including ribavirin, which is useful for chronic hepatitis C, some pretty strong medications. Bicalin, this molecule, and then glycyrrhizin, which we're going to talk about in a second, showed some really useful antiviral activity in a similar virus, not necessarily in this one. So again, bridging this emotional resilience and immune resilience. Licorice is a botanical that I know Peter and I use very often. Often we use the root. Licorice historically has antiviral properties, but it's also very useful in helping our bodies more effectively process that cortisol that we produce as that main stress hormone. Well, you saw on the previous slide that licorice, glycyrrhizin, was studied in its role for the original SARS virus. They did additional research down the line, and it actually said that glycyrrhizin, which is the main antiviral component of the glycyrrhiza plant, was one of the most useful tools in that antiviral toolkit, again, comparing to some pretty strong antiviral medications. It's really important that I say that people who have hypertension should really avoid taking glycyrrhiza in its crude form, because it can increase blood pressure and its effect on the cortisol receptor. So again, here's a useful tool that we've used for centuries as a adaptogenic plant that helps us deal with the emotional stressors that also seems to have some interesting research around antiviral properties. And this, in talking about that cytokine storm, there was a study that just came out at the end of April that talked about the combination of vitamin C, turmeric, which we talked about, and glycerinic acid, that said that it addresses 88 or so different targets of how the virus affects our bodies, and in a very real way can be useful, especially in high doses, at addressing that cytokine storm that we're so concerned about across the board. Lemon balm is another really wonderful herb, a little bit more gentle. I often will recommend it for kids in a tea form and things like that. We know the lemon balm is a mild antidepressive. We know that it can be helpful in people who have hyperthyroid symptoms, which can cause anxiety, but it also directly affects how GABA, our main calming brain chemical that Dr. Sood mentioned earlier, is broken down in our nervous system. So lemon balm in a very gentle way can have some real effects, but we've also used it historically and traditionally for viruses. We've used it historically for herpes virus in particular. And there's some interesting research that avian flu virus in particular was susceptible to Melissa officinalis essential oil, which is the oil of this lemon balm, when combined with an antiviral. So again, really walks that line, sits at the intersection between emotional resilience and immune resilience. Resveratrol is the reason that many of you probably justify drinking a whole bottle of wine and saying it's good for my heart. We know that it's got some anti-inflammatory benefits. And so again, from the perspective of how does this virus impact our immune system and our inflammatory pathways, resveratrol does so in many ways. It changes how we produce a lot of immune molecules. Again, I'm going through this quickly, but we will share these slides. Now, what's important is that resveratrol has actually been studied as a useful molecule in mood. This was a meta-analysis of 225 patients where they combined multiple studies, and they said, well, it might not be that useful for cognitive performance, but it does seem to be useful for mood. So again, from an emotional resilience perspective. Resveratrol was also studied with the Middle East Respiratory Syndrome coronavirus. You've heard of MERS when people talk about SARS, another one of those really dangerous and scary viruses. In vitro, so this wasn't tested in humans, but in the test tube, extracts of resveratrol were actually quite effective in slowing down the progression of the MERS virus. So another one that we need to be studying as we move into this dance phase of understanding how to address this virus. Melatonin, people have heard of melatonin and its function at addressing sleep, but we've also known for a very long time that melatonin is an important regulator of the immune system. And early days when this coronavirus thing came out, there was some early research that said, well, people who are older tend to have a worse reaction, tend to be more susceptible to coronavirus. And then there was some tangential research that said, well, it's possible because after about age 30, our melatonin production goes down. Melatonin being an important hormone, that's why people have difficulty sleeping sometimes as they get older. But it's also important to consider the way our immune system and our bodies react if exposed to coronavirus. So this was an article literally hot off the press, preprint. It's really, just came out in May, that talks about 50 some odd mechanisms as to how melatonin plays a role in our immune system's ability to regulate itself if exposed to severe viruses like the virus that causes COVID-19. And then finally, vitamin D. We often think about vitamin D from an inflammatory perspective. We think about it from the perspective of cancer prevention and heart disease prevention. Rarely, though, do we think about it from the perspective of mood. And we know that there's interesting research that exposure to the sun impacts positive mood almost as effectively in some cases as SSRIs. But there's really good reason for that. So vitamin D helps us to calm our brain waves by impacting our GABA receptors and our NMDA receptors. It also directly impacts specific neurotransmitters that Dr. Sood mentioned earlier, like dopamine and serotonin. And we know for a lot of different pathologies, supplementing with vitamin D can be quite helpful, and often a good target dose is 45. What people are less aware of these days, and this is a study that talks about the role of vitamin D in depression, but what people are less aware of these days is the role of vitamin D in risk of COVID. And so there was a recent study that came out that basically looked at populations who have low vitamin D levels all over the world and concluded that people with low vitamin D have a 2 times higher risk of the severe sequelae, not necessarily not getting access to the virus, but having severe outcomes of the virus. So 2 times higher risk. And a different study that just came out in the beginning of April talked about the role specifically of vitamin D supplementation as a mechanism by which we can protect our bodies. And so again, this is not medical advice. Don't go out and start taking vitamin D without talking to your healthcare provider. But this study concluded that somewhere between 2 and 10,000 international units of vitamin D might be protective in people who are deficient. So a lot of tools in our potential toolkit, really trying to address these multiple paths to resilience. We started with this concept of the role of mindfulness and grounded education, understanding about what's happening in the world, and then moved to how nutrients and botanicals have a real role to play to help us on both fronts. So, thank you for listening.
Thank you so much, Dr. Robert, and also Dr. Rishi. And, as I was listening, I think I was doubly inspired by not only the intelligence and the breadth of knowledge of both of you, but the organic compassion that just seems to come with your words and your thoughts, and just having worked with patients, that we've shared with both of you, I could just honestly say that you guys are amazing resources, and truly changing the course of healthcare by being who you are. So thank you so much. I would like to get to some of the questions, and I know we're probably going to run a little late. I also noticed that the number of attendees have only increased, so I'm really excited you guys are hanging in there with us, and we want to get to some of your questions. So I'll look at these now. So one attendee asked, and I think I'll send this to Dr. Sood, who's also a pediatrician and child psychologist expert. What advice would you have to help parents reduce their child's anxiety during this time?
Yeah, I think that's really crucial, important. Kids are now at home, right? So parents are teachers, parents are essentially all kids have during this time. And I think the first thing is to just be okay with, like, this is a tough time, and just for the parents to sort of give yourself a break. This is challenging, and I don't know if there's the perfect way to do this, but I think how you manage your own stress is crucial. So, I would sort of help coach a parent on, their morning routine. Like, how do you wake up? What do you say? I generally start my day with, today is going to be a good day. So when I do that, my mind looks for why today is going to be a good day. I would recommend that gratitude practice that Dr. Rob was I'm going to start to incorporate incorporate that. That's one. So I would do that. Drinking some lemon water, if, you just drinking some lemon water, maybe after that gratitude practice, some warm lemon water could be grounding, and doing some physical activity. So really taking care of yourself first. So when you do that, you're taking care of your brain, you're reducing your stress, and your children may ask you questions that you may not have the answers to. And it's okay to say, I don't know. I think maybe trying not to respond to every impulse that you have when your child acts in a certain way or asks questions that are challenging is another way. So I think just giving yourself some space and some just some forgiveness, and taking care of yourself. I think those are the first steps. But yeah.
Beautiful. Yeah. Forgiveness, right? Forgiving ourselves, realizing we don't have to get all those things done, that, give ourselves a little bit of a break. I know for many of the patients I work with, I see this common theme of, oh, I'm not doing enough. I should be doing more. I should be doing something different. And that's hard to live under. Right?
People feel like they have to learn how to play a new musical instrument or learn a new language in the midst of a global pandemic. It's just, it's too much to put on ourselves.
I'm laughing because I'm trying to teach myself that darn guitar. So actually, a colleague of ours, Dr. Michael Scott, had a question which I would like to direct to Rob. Can you speak briefly to the use of heart rate variability and coherence in training for building resilience?
Sure. Thank you, Michael. That's a great question. I started with this talk about the idea of precision medicine and really understanding how our bodies are functioning at different times. Heart rate variability has really proven to be one of our most reliable mechanisms by which we do that. That autonomic nervous system, that sympathetic and parasympathetic nervous system that we talked about, really plays a role in communicating between brain and body, and then vice versa. And heart rate variability is a wonderful measure of how effective and cohesive that communication is. And what's really great is that we can train ourselves for our heart rate variability to improve. And across the board, we see beyond just depression and anxiety, but for physical health parameters, people who have higher levels of heart rate variability. And so what that means is, if you take your pulse, your pulse is never just 60 or 70 or 80, it's always speeding up and slowing down. And what researchers found out decades ago is the wider the ranges between the fastest change and the slowest change in the beats is actually a good indicator of physical health. All the way from survival rates in the neonatal ICU and really sick newborns, all the way to people at the end stage of life with Alzheimer's disease. Across the board, it's a way we can tune into how our body is functioning. And what's really cool for me about the heart rate variability research is that all the traditions that have been around for thousands of years, like I talked about meditation and mindfulness, and we've known that movement is important. We've known that changing your diet is important. All of them individually and collectively actually improve HRV rates. So as naturopathic physicians who want to take this whole person view of the body, what we find is that it's a nice way to track if the lifestyle changes that people are taking on are sustainable for them, but also helpful for their physiology.
Great. Thank you, Rob. And that is something Rob does in the office. And you teach patients about that and how to do it for themselves so they could take it home and do that.
Yeah, there's this idea of biofeedback, and we have a lot of tools for biofeedback, but it's really understanding how your nervous system is functioning in real time based on whatever the environment shows. And there's nothing like an internal locus of control in medicine, understanding how your body works and understanding how to help yourself. It makes everything else much more likely. So yeah, we do that in the office. Thank you.
Excellent. And regarding the Amen Clinic, Donna had mentioned, she says, I offer, and maybe Dr. Sood, you could talk about this, a free work from home report for those who are finding working from home personal productivity dropping, insightful and tailored to the specific individual's personal style.
Mm-hmm. Yeah. When working with clients, we do kind of do this, we do, at least to do with individuals, clients. I believe we do have that report. I can, Donna and I, we can touch base and try to provide that for the individual. But yeah, it's working with the individual, the precision-based medicine, the personalized medicine, which is important. Not everyone, will benefit from the same routine. But I'll definitely, connect with Donna and we'll figure that out. Right away.
Okay. Another question submitted from a social worker, recovery coach. What seems to be transpiring in my patients who are triggered right now? I have a 29-year-old male with a difficult time with alcohol use. Any ideas of what can be supportive? What are the next steps for care that you think may help? Either of you?
Well, I'll briefly, I think, say that when we're faced with, fear and oftentimes the possibility of our own mortality, the thing that our sort of human nature is to try to block those feelings as much as possible. And that's where substances come in, is really to try to numb our response to things. And so I think a lot has been learned, and I'd love Dr. Sood's opinion on this too, but from the world of acceptance and commitment therapy that talks about sort of, within the context of the world we live in, finding new values and new things to work toward, so that we don't have to try to self-medicate, which is very often what we do with alcohol.
Yeah, absolutely. Finding a purpose, a calling, something to strive for. Sort of say to this therapist, it's wonderful that this individual can open up to you, right, and talk to you about that very matter that they are using alcohol. So acceptance, committing yourself, using in a motivational interviewing sort of technique. What other things that can you do to replace that, or maybe exercise before you are preparing to drink in the evening, that maybe gives your prefrontal cortex more strength so that you can resist the urge, right? So again, the gratitude is wonderful, focusing on sleep, but just being there is amazing that we can be there for our clients. So yeah.
That's great. A quick note to Dr. Sood: Emily, Molly, and Connie say hi. So, thought I'd share that with you. And just one last question, and this is from Eleni. Hello to my dream team. I'm wondering what your thoughts are on dealing with the grief of losing the life we had before COVID, and how do we process the shock of this pandemic? Happy to see you all.
Hey, Eleni, it's great to hear from you. I think that same acceptance and commitment therapy idea is important here. When we work with people with anxiety, or I work a lot with people with chronic pain, there's this paradox that when we try to wish something away, whether that's our pain or our feeling of anxiety or whatever's happening in the world, it paradoxically just kind of hooks on a little bit more effectively, and it becomes a bigger component than it already is. And so it's a challenge, but the paradox is, as much as we can learn to be with those feelings, as opposed to trying to wish them away, they're much less likely to have a severe hold over us.
Yeah. And I'm sorry. Go ahead.
Go ahead.
Please, you next.
Me next. Yeah. No, I think that radical acceptance, just allowing it to come in. I think Rumi, the poet, wrote that poem, The Guest House. I think welcoming your emotions, Rob is talking about, I think it's so important. And just working through it and realizing that this is a collective struggle. You're not in it alone. It's a collective grief that we're enduring.
Yeah, and the thought about losing life, maybe we'll finish with this, losing the life we had before is, and I think that's a constant struggle when we have anxiety and we have depression, and this idea of needing to have life a certain way. And, I think from more of a Buddhist philosophy, they would say, well, things aren't good, things aren't bad, they just are, and this is something that is going to come, and it's something that is going to go, and we're going to move through it. And in many ways, certain things are going to improve as a result, and I think it's important at this time to focus on the things that can improve and can change as well. And because, the truth is, right, in a couple of 100 years, none of us are going to be here. It's not going to, so all we could do is enjoy this moment. So, and I have to say, I have absolutely enjoyed this moment. It was an honor to spend time with both of you and to spend time with everyone who is with us today. So this will be posted so you can listen to it again. Please feel free to share it with your friends. Also, please do connect with the Amen Clinic if you're interested in working further with Dr. Sood. And of course, I'm Rob and myself are part of InnerSource Health, and we're here for you, and we support you as well. So thank you very much, gentlemen. It's really a pleasure, and I look forward to doing this again.
Thank you, Peter, and thank you, everyone.
Thanks, everyone.